Let's continue the discussion. Welcome all. Welcome to this M Excellence NLT question answer discussion. And this is a pretty interesting question in front of you all. Ram, a 60-year-old diabetic male, came with fever and tachypnea. X-ray have shown diffuse pulmonary infiltrate. See the appearance is a very ghastly appearance in the left ear. X-ray have shown already diffuse pulmonary infiltrate. Biopsy of skin lesion on ear is done. Histopathology picture of commodity methamphetamine silver nitrate stain lesion is given. What is the treatment of joint in this condition? So there are 4 options that are to be given out here. You have to pick the right answer. We are going to come up with the answer of this question. So what we have seen, there is a particular condition. The patient is actually presenting with a verrucous lesion in his left ear, and there is a yellow stain on it, and the associated features in this particular patient that have been given out here is an adult male who is immunosuppressed, which is very alarming condition in this particular disease that have created this sort of alarming picture in the ear. And patient is having fever and tachypnea. So the respiratory symptoms are there. X-ray have shown diffuse pulmonary infiltrate. And biopsy of skin lesion here is done, and that is where you are seeing the gomody methanamine silver nitrate stain, which is giving the broad-based fungi. So you can understand the fungi which is causing this particular symptom, both the respiratory symptom and the skin finding, hepatological finding. And then we have to identify, say, broad-based fungi and dimorphic fungi, which fungi can cause it with this sort of features. And the fungi is Blastomyces dermatitis. Blastomyces dermatitis. So what should be the treatment? The treatment of choice in normal cases of Blastomyces dermatitis is itraconazole. But here the patient is immunocompromised, as because the patient is having diabetes. So treatment of choice in that particular case is going to be amphotericin B. Now, if the patient is having CNS finding like brain abscess or meningitis, then we have to add fluconazole. Fluconazole, because it is having better CNS penetration, brain penetration. Fluconazole, we add fluconazole there. Now see the pathological HP picture. The histopathological picture is going to show you there are granuloma, there will be granuloma, and within the granuloma there will be dimorphic fungi. So you understood this is a Blastomyces dermatitis infection, and most common presentation is that the one-liner is asymptomatic. Most common organ affected is obviously lungs. These are all one-liner that is important in NEET and FMG examinations. In lung finding can be acute, as presented with pneumonia like features. They can be chronic like tuberculosis like features, and can also present with diffuse pulmonary infiltrate, tachypnea and fever with hypoxia, which is seen in ARDS. And if the patient is presenting it with ARDS, which is having very grave outcome, the mortality is very high in these cases. Alongside the lung, the other organs that generally gets affected, one of them is brain, where we have already said there will be brain abscess, there can be meningitis, and other organ where it actually affects is bone, where it can presented with the features like acute osteomyelitis. It can also affect testes, where it can lead to infertility like conditions, and also can affect prostate. So in a nutshell, these are the important points. Apart from the pathology finding or the fasting or KOE smear to find out the fungal agent, we can also do the antigen testing that is done on the CSF, on the urine and the serum. So roughly we have covered all the important informations ranging from the pharmacology. These are the pharmacology points. These are the clinical findings that we already mentioned, the type of condition that can arouse in lung also that we have already touched, and all the organs that are affected, that we also have said the lung is the most affected organ, ranging from 50 to 70%, and most common finding is asymptomatic. We have touched the diagnosis protocol. We have already talked about the treatment protocol, and mostly we have covered all the important points from this particular topic where the question can be asked. Now today is National Doctors Day, and it is to remember the birthday. This is the birthday of Dr. Bidhan Chandra Rai, who was the first Chief Minister of West Bengal, and wish you all a National Doctors Day. And at the same point of time, we should remember the incident which shook the India, and two young interns got injured in a shuffle with the patient party, and they got badly. One of them got very badly injured and still now is recovering. And we actually thankful to all the young guns who fought and all the people who have supported their movement and understood their grievances, and we are really thankful to them for supporting us, and we will serve them. All the young people are going to serve them, but at least recognize the kind of problem they are facing and the kind of challenges they are facing. As a society, more you will recognize, more better service you are going to get. Thank you.